Welcome to the Doge and the Maha News Network. In this video, we're going to focus on Make America Healthy Again, and we're going to look at a couple videos by Dr. Casey Means. She wrote the book called Good Energy. I'm going to go ahead and leave a link down below so you can check out that book if you're interested. But we're going to check out a couple of her videos where she's talking about our food and how it's impacting our health. So let's get started. Okay, so this is a short clip when she was on the Bill Maher show.
So more than a health epidemic, which is what we have in this country, I mean, health is getting destroyed in the United States, which you don't really talk about because it's not profitable to heal in this country. It's profitable to keep people sick. And
wow, she's laying out some truth there. It's not profitable to heal people. It's profitable to keep them sick. Ooh, ouch.
And drug them, cut them, and bill them, which is what we learn how to do. And really what we have here is a disconnection crisis. And the healthcare crisis is one branch of that tree. We're disconnecting the body into 100 separate parts and not seeing as a unified system. And we're disconnecting the body from the environmental conversation, which actually we're really one and the same. You know, we are totally connected to nature, and in destroying nature through the pesticides and the way we're treating animals, our health is a reflection of what we're doing to the earth.
She makes some really interesting points how, the healthcare system and the doctors, they're taught to look at things from specific points. For example, they're all experts in different areas, but they're not taught to look at the body and our health from a holistic perspective. Maybe if there's something wrong with your foot, you go to a foot doctor. If there's something wrong with your ears, you go to an ear, nose, and throat doctor. If there's something wrong with your gut, you go to a gut doctor. And they're all specialists in their own little area, but there's no one looking at the body holistically. And so that's what she's saying, is that the training in the medical system is to look at specific parts and not outside of that. So it's kind of interesting to hear that.
Was having safe food and ending the chronic disease epidemic. Our children are now the unhealthiest, sickest children in the world. Don't you want healthy children? And don't you want the chemicals out of our food? And don't you want the regulatory agencies to be free from corporate corruption?
Hello. RFK bringing it. Don't you want healthy children? Don't you want the regulatory agencies free from corporate corruption? Man, don't you want a clean environment? Yeah, I love it.
So is RFK right? Those stats are pretty real that I'm about to share with you. 40% of children are overweight and obese. 36% of kids have mental, emotional, or behavioral disorders. Autism rate is stunning. 1 in 22 in certain states. Young adult cancers are up 79%.
Wow, look at those numbers again. 40% of kids are overweight or obese. Man, that's crazy. 36% of kids have a mental, emotional, or behavioral disorder. Wow, so over 1/3 of kids have some kind of mental or emotional or behavioral disorder. Autism rates 1 in 22 in some states, he said. Man. And young adult cancers up 79%. What is causing that? I don't know. Could it be food?
We're on track to have 1 in 12 American adults with cancer in their lifetime. These numbers are stunning, and they're going up. 75% of American adults over the age of 55 have some type of chronic illness. It might even be you. So our food is getting us sick intentionally. That is the main reason. And pure profit is another reason. Big pharma behind it. Overall, that's the premise of the #1 best-selling book in the country, Good Energy, the surprising connection between metabolism and limitless health. Casey Means, welcome back to the show. You were nodding when RFK was talking. You believe he could make a difference in the principles you wrote about.
It's historic that this is being talked about at the presidential level. Brian, it's actually very simple. Americans are getting increasingly and astronomically chronically ill, and it is largely because of our toxic, ultra-processed food system. There are 3 things that we really need to focus on to
Before she gets into the 3 things, yeah, it's really cool that this is being talked about at the highest levels of government. With the election of Trump and his designation of RFK Jr. as the Health and Human Services Director, or Secretary, well, assuming that he'll get through the Senate and he'll become the official Secretary of HHS, and hopefully he can get in and just shake some things up. but it is awesome that this is being talked about at the highest level. And it makes me crazy that people on the left are fighting this so hard. I mean, what's the fight about? Why is this political? I mean, don't you want healthy food? Don't you want to get rid of ultra processed food? Don't you want to get chemicals out of our food? Why are you fighting this? Please come and join, and let's see what RFK can do and streamline our health system. Streamlining our food, making it healthy for all of us is a good thing, I think.
Turn the tide that is destroying American health, and RFK is talking about them. The first is that we have to fix the incentives that are making the unhealthy food toxic, cheap, and affordable for Americans. We need to incentivize healthy foods being the cheapest foods on the shelf. The second thing we need to
incentivize the healthy foods. I'm not exactly sure what incentive she's talking about, so maybe she'll share more on that.
do is get the conflicts of interest out of the food science and the government agencies that control our food guidelines. And the third is that we need to improve medical education. So those are the three things that RFK is talking about that are so important for turning the tides.
And so
Okay, so fix the incentives. So there's some incentives in our food systems that incentivize making bad food cheaper, and that's why it's more readily available than good quality food. So change the incentives in our overall agriculture and big food systems. Get rid of those incentives that are promoting bad food or food that is not healthy for us. And incentivize real healthy, maybe like farm to table type of food. Get conflicts of interest out of the science. How many of these scientific, quote, studies are funded by big pharma or big food or big agriculture? Probably almost all of them, right? So it's really important to get those conflicts of interest out of the science so that the science can actually be objective. And then everyone can look at the science and we can make up our own minds, right? We don't need to have some big corporation deciding which scientific studies we see and which scientific studies we don't see, because maybe the outcome doesn't give them what they want or what they expect or what's going to give them the most money. And then the third thing she is talking about there is improving our medical education. And I think she's probably referring to making medical education more holistic and less zeroed in on specific areas of the body, and make it more holistic, considering things like the environment and food and exercise and things like that as well. Not just focusing on the drugs and the surgery for your specific ailment. Look at your body holistically.
sometimes people say government's the problem. Not here. It would be government could fix it. Now, fix the incentives. So I got to get farmers, incentivize them to grow differently?
So right now, Brian, the Farm Bill is a $500 billion bill that's renewed every 5 years. And currently, the vast majority of the spending goes towards supporting farmers to grow commodity crops that are largely turned into ultra-processed cheap food. This is why the cheap food is the unhealthy food, because taxpayers are subsidizing it.
Right.
So we need to incentivize farmers to actually be growing the food that makes us healthy. And right now, that is only 0.1% of the Farm Bill subsidies. The second incentive piece.
Whoa. Okay. Back up. So only 0.1% of the Farm Bill is subsidizing healthy foods. The majority of the money is going towards unhealthy foods, or food that is going to help the kind of ultra processed foods. I don't totally understand all of this. I'm going to have to get her book and check it out. And again, I'm going to have a link to her book down below, and I want you to check that out if you want to as well.
Is that a lot of the Farm Bill goes towards food assistance programs like SNAP and WIC. And right now, SNAP, which supports over 10% of the U.S. population, 10% of that budget is going straight to soda, and about 55% is going to ultra-processed foods. So taxpayer money is being incentivized to go straight into the hands of these diabetes water companies and ultra-processed food companies. We could
I like how she calls soda companies diabetes water companies. That is so true. But that's really interesting. So this government program that is giving people money to buy food, these food programs, she said 10% is being spent on soda. And then another 55% is being spent on ultra processed food, probably like chips and crackers and snacks and cookies and things like that. And so what is that, a total of like 65% is basically going towards junk food, not even healthy food or veggies. I would be really curious to see what percent actually goes to raw vegetables. I'm guessing it's probably less than 1%, maybe, definitely less than 5%. But definitely if the government can get in and say, okay, X number of dollars or X percentage of the money that we give you needs to go towards these healthy foods, or maybe just prevent companies from putting poison into the ultra processed foods as well. Get rid of the ultra processed foods, get rid of the chemicals, and then they can buy whatever they want.
Change those incentives rapidly to make each dollar spent on SNAP more effective, more valuable if it goes towards real food that keeps us healthy. And then the third incentive piece is that we need to think about tax advantage dollars like HSA and FSA. Right now, these amazing programs that let us use tax advantage dollars towards health, they're mostly going towards drugs. We could steer those HSA dollars towards preventative tactics like food as medicine and nutrition.
So when Trump says, if I get elected, I'm going to put him in charge, you believe he knows it so well. RFK could do this. Time Magazine pushing back. I mean, look at this headline. I know this got a lot of publicity for your book because it's so ridiculous. What if ultra-processed foods aren't as bad as you think?
Come on, Time Magazine. What a joke. No wonder no one has confidence in the old media. Time Magazine. What if ultra-processed foods aren't as bad as you think? Oh, come on. That is ridiculous. Talk about gaslighting.
What would you think about the content of that column and the premise?
This article was laughable. Of course, this article crops up right after RFK says he's committing to make America healthy again with the help of Donald Trump. This article sprung an outrage from the American public, with tens of thousands of people going to social media in hordes saying that this is ridiculous. We are not going to be gaslit by the media anymore about common sense about nutrition. We all know that frankenfoods that come from a factory that are filled with toxic additives that are banned in Europe are not healthy for us. Real food from the ground, from sustainable soil, is what is good for our health. And this
Frankenfoods that come out of a factory filled with toxic chemicals that are banned in Europe. Man, she is nailing it right there. I love that word, Frankenfoods. It's some kind of like Frankenstein style of food where they're just putting together all these different chemicals and making the food. It's not even food, but they're making it taste good and making us hungry so that we want more and crave it more. And it's just a bunch of chemicals that we're putting into our bodies. And most of those chemicals are actually banned in other countries.
This article tried to seed doubt in it with the normal media playbook of questioning the science and invoking social justice talking points to talk about how we could never get rid of ultra-processed food and normalizing it. But we need to realize the ubiquity of ultra-processed food that is making Americans just astronomically ill. This cropped up in the 1980s. That's when it started skyrocketing, and that's when we started getting sick. So the American public knows. And the astonishing thing is that after people took to outrage on social media and RFK posted about this, they changed the title of the article because they knew it was so absurd.
Right.
Time Magazine changed the title of the article. Oh my goodness. And I like how she's talking about this ultra processed food coming in like in the 80s, and that's when we started to get heavier, and that's when the chronic illnesses have started to climb. If you look at charts like that, yeah, I mean, that's the evidence right there. And Americans know it too. You know, we're not dumb. And a lot of the quote healthy foods, like they showed pictures there of those granola bars and things like that, a lot of that quote healthier food still is ultra processed. And, you know, it's marketed as healthy options and things like that. And still, you know, I eat it, and I know a lot of us continue to eat it, but it still contains a lot of those toxic chemicals in it that hopefully RFK will work on getting rid of and outlawing those chemicals and getting them out of our food system so we can have actual healthier food like other countries do.
And just so to show you, if you went over the American family, tell them how to eat better and make it affordable. Casey, you've done that, and Time Magazine sold a whole bunch of your copies. We don't have time for it, but Joe Rogan talked about it. That helped too. Good energy, great job. Thanks so much, Casey.
Man, so much good stuff in that video there, Dr. Casey Means. I got to get her book. And again, if you want to get that book as well, I do have a link below. It is an affiliate link for Amazon, so check that out. If you do use that link, I will get a small kickback, which I appreciate. But I'm on this journey as well. I'm learning about this as we go. I'm learning about healthy food. I'm learning what big food has done and some of the history behind it. And so this is a fun journey for me. I want to be healthy again, and I'm super excited about RFK Jr. and the Make America Healthy Again agenda. I want to see where this goes, so I'm going to follow the news on this every single day. Again, if you want to see updates on this every day, make sure you like and subscribe. And thanks a lot for watching, and I will see you on the next video.